Have you ever wondered what's really in those silvery grey, even black fillings in your mouth, and whether they're actually safe and maybe affecting your energetic and physical health? Mercury amalgam filling removal. What you really need to know before taking the leap. Millions of people have amalgam fillings, but more and more people are waking up to concerns about them, about mercury exposure, health implications, and the possibility of removing them. But what's the truth? And how do you do it safely, like asbestos removal? It's got to be done safely, right? So let's dive deep into the world of amalgam removal with facts, holistic tips, and one powerful case study that may just inspire your own healing journey. What if that silver filling is holding back your health? What if you brush your teeth, you eat healthily, you try to live a clean lifestyle, right? But did you know that those little silvery grey fillings could be leaking mercury into your system every single day? And this is not fear-mongering, it's a real concern backed by science. You see, mercury vapor from dental amalgam can be absorbed into the body, and for sensitive individuals, that exposure can cause symptoms that mimic anxiety, fatigue, digestive issues, and much, much more. So the question becomes, should you remove them? And how can you do it safely? What is amalgam and why is it controversial? You see, dental amalgam is a mixture of metals, primarily mercury, silver, with a little bit of tin and copper, and for decades it's been used as a very effective, durable, low-cost filling material. But mercury makes up about 50% of an amalgam filling, and mercury, well, it's the most powerful, most potent neurotoxin there is on the planet. While regulatory bodies claim amalgam is safe for most people, growing research shows that mercury can vaporize and be absorbed by our lungs and bloodstream, especially during chewing or grinding our teeth. The World Health Organization has identified mercury exposure as a health concern, especially for vulnerable populations. The controversy lies here. Do the risks outweigh the benefits? And if you've decided they do, how do you proceed? The dangers of improper removal. Let's be clear, removing amalgam without the proper protocols, the safety protocols, can release more mercury than simply leaving the filling alone. This is why you must work with a dentist who follows the safe mercury amalgam removal protocol or technique. And this ensures specialized air filtration in the room, rubber dam isolation or a special tool that isolates the teeth to prevent swallowing of the mercury particles, oxygen masks for both patient and practitioner, high-speed suction and water irrigation to minimize heat and vapor. On top of that, protective gear for all involved. And without these precautions, you risk mercury exposure to your mouth, lungs, and bloodstream. Fact. So, real life case study, Emma's story. Emma, a lovely 38-year-old yoga teacher, she had 5 amalgam fillings since she was a teenager, and in her early 30s, she began experiencing mysterious symptoms. Symptoms like brain fog, fatigue, mood swings, and joint pain. And after months of tests, medical tests, and no clear diagnosis, an holistic practitioner asked a simple question: do you have amalgam fillings? And then the dots started connecting. Emma researched the effects of low-level mercury exposure and decided to get her teeth treated and those fillings removed, but only by a dentist who respected the SMART protocol. She followed a strict detox protocol before and after each session, mainly including chlorella, activated charcoal, saunas, and liver support. And within 3 months of her final removal, her energy improved, brain fog cleared, her mood stabilized. And you know what? Emma's story isn't rare, and I have witnessed numerous stories just like that and better during my long career as an holistic dentist, but it only became a healing story because she did it the right way. The holistic way to prepare for amalgam removal. Amalgam removal isn't just a dental procedure, it's a full body event. And here's how to support your system. Ideally, work with an environmental doctor and/or nutritionist or homeopath that is experienced in heavy metal and parasite detoxification. So, number 1, nutrient support. Optimize levels of selenium, zinc, magnesium, and vitamin C. These help the body bind and eliminate heavy metals. Number 2, binders, such as chlorella, bentonite clay, zeolite, and activated charcoal can help capture toxins released during the removal process. Number 3, detox pathway support. Make sure your liver, kidneys, and lymphatic systems are working well. Then there's dry brushing, sauna therapy, hydration, and herbs like milk thistle. Number 4, nervous system regulation. Grounding exercises, breath work, and vagus nerve stimulation support the body's ability to detox safely. Number 5, post-removal care. Continue binders for a few days, eat a clean, anti-inflammatory diet, rest, and let your body do the work. What to replace your amalgam metal fillings with. To replace your amalgam fillings, your dentistry may recommend the following options: BPA-free composite resin, ceramic inlays, zirconia type inlays and onlays, gold in rare cases for durability. But always ask what materials are being used and whether they are biocompatible with your system. And you may want to do an applied kinesiology muscle test to help with this. So, risks, rewards, and is it right for you? Not everyone needs to rush into removal. Please do not just rush into this. If your amalgams are stable and you're not experiencing symptoms, it may be okay to leave them for a while now. And certainly have them checked and even measured with an electrician's multimeter to assess the electrical charge coming from them. However, if you have symptoms of mercury sensitivity or simply want to live a toxin-reduced life, the decision is worth exploring, in my opinion. And with the right support team, amalgam removal can be a turning point for your health. You deserve to feel clear, clean, and empowered. You don't have to live with invisible toxins in your body. And you certainly don't have to be wondering if that nagging fatigue or brain fog is just in your head. Amalgam removal, done the right way, can be a doorway to greater health, clarity, and vitality, in my opinion. So if this video sparked curiosity or courage in you, deep inside you, leave a comment, share your story, and remember to subscribe for more of my holistic science-backed tools, videos for a healthy, radiant life. And your healing is real, your voice really matters, and your health is worth protecting. One step, one choice, one breath at a time. Much love, and I look forward to meeting you in person or at my next video presentation. Smile healthily, smile healthy. Mark, the Dental Shaman.